Mm-hmm.
Well, if you guys are ready, we'll go ahead and get started. I think we've given everybody a long enough. I know we'll still have some people come on, but we'll um, again we're recording this, so they'll get that. So
Great.
good afternoon, everyone. My name is Marty Mascari. I am with the North. I'm a contractor with the North Central Texas Area Agency on Aging, and I'm here with Melinda Gardner, who's with the North Central Texas Area Agency on Aging and Senior Medicare Patrol, and also uh, the Better Business Bureau Foundation. Is that right, Jennifer?
It's the Better Business Bureau Education Foundation out of Houston, Texas.
Out of Houston, okay.
Texas. But I'm also with the Texas Senior Medicare Patrol, which is the whole state.
So this is our partnership. We partnered together to put this on today, and I want to make sure you know that we all partnered together to make this happen.
Yes.
So we're ready to go to the next one. And the next slide really has to do with, and this is, the deadline's tomorrow for this, but I started at the beginning of March, and this is not a scam, I promise you. I started at the beginning of March. We're not trying to give you an example of a scam here. I started at the beginning of March trying to collect new topics that you guys are interested in us providing webinars on and trainees on. And so what I've done is I've set up a link that I'll email you as a follow-up after we're done today. And you can go in there and submit your name and email address and the topic and a little bit of information about what you would like to see included in that topic. You can enter as many times as you want. Each time you go in there, you'll do one topic, and you will get your name put in a hat as many times as you've put in an entry. And then after the first, we will draw for 3 $50 Amazon gift cards to be given, e-gift cards to be given away, and we'll notify the winners by the 7th of April, and we appreciate your help with that. Hopefully that helps you and it helps us. I know you're all busy, so we're encouraging you to try to help us if you can. And so the next thing we're just gonna hit the road running here, and I'm gonna introduce Melinda to get started. And Melinda, you've got it.
All right. Thank you very much, Marty. Thank you for coordinating this presentation so that Jennifer and I can share this important information with our communities. As Marty mentioned, my name is Melinda Gardner. I am a benefits counselor with the North Central Texas Area Agency on Aging. Our agency is part of a network of state health insurance assistance programs, and so that's a national network. And here in Texas, our program is called HICAP, Health Information Counseling and Advocacy Program. What we do is we help people understand Medicare as well as other government benefits. We help if they want to apply for help with their medical costs. And so we have various programs within the North Central Texas Area Agency on Aging. And I have listed our website on this slide, so you're definitely welcome to check that out. And there may be a program that maybe you or some of your clients or family members may be eligible for. We don't charge for any of our services. We do get funding from the federal and state government. Also, I am the project coordinator for the Texas Senior Medicare Patrol, and I'll let Jennifer tell you a little bit more about that as we get started. At the bottom of this slide, there is also another website, shiptacenter.org. We may have individuals on this call that are outside of Texas, and so if you go to the shiptacenter.org, you would be able to find your SHIP in your area. So it should encompass the whole United States. And then also the smpresource.org provides more information on fraud and abuse and lets you know what you can do to help keep people safe from fraud and abuse, and also how you can volunteer. And I'll turn it over to Jennifer.
Thank you, and thank you, Melinda and Marty. It's been a pleasure working with you all, as always. My name is Jennifer Salazar. I'm the Texas Senior Medicare Patrol Director for the great state of Texas. And if that title wasn't long enough, I also work for the Better Business Bureau Education Foundation out of Houston, Texas. So when I'm in the Houston area, we cover, I believe, 16 counties. But when I'm outside of the Houston area, I am official Texas SMP. So I cover 254 counties. So I wear a BBB hat and a Texas SMP hat. But I want to tell you more about the Texas Senior Medicare Patrol. Next slide, Melinda. So, but first, let me get to the agenda. I do apologize. We're going to discuss today the Senior Medicare Patrol, and scammers love to read the headlines. So, of course, the #1 scam we're going to be discussing a lot about today is COVID-19 scams. We're even going to talk about the COVID-19 vaccine scams. And guess what? We even have a COVID-19 survey scam out there. We're going to talk about other scams. And what we did is we're talking about the scams we're seeing the most in the state. We're seeing one that's called stealing from the grieving, unneeded repairs. I'm sure a lot of you were impacted by what we're calling snowvid. It was the winter storm with COVID, phishing emails, and not the kind of phishing I like to do on the weekends. Romance scams, don't go looking for love in all the wrong places, the grandchild hook, durable medical equipment scams, and those darn robocalls. That's what we're going to discuss today on today's call. Next slide, please. And I would like to tell you all about the Senior Medicare Patrol. First off, the Senior Medicare Patrol, there are 54 in the United States, including Guam, Puerto Rico, the Virgin Islands, and even Washington, D.C. Your Senior Medicare Patrol, if you are calling from in the state of Texas, is run through the Houston BBB Education Foundation, like we've been saying. What do? Well, we try to stop Medicare fraud, error, and abuse from happening. And we have a wonderful team of volunteers that we recruit and we train. We are currently up to 190 volunteers, and we teach them about our message and how to try to stop fraud before it happens. And they go out and do outreach on our behalf. Now, because of COVID, we're doing outreach like you see right now on Zoom, WebEx, Microsoft Teams. Now, what if fraud, error, and abuse happens? Well, we build the cases. Our staff and I build the cases. And when I say we build the cases, we don't investigate. We build it. We build it, and then we send it to what's called the Medicare control units. The Medicare control units are like, for example, the Office of Inspector General, the Texas Attorney General's Office, Texas Department of Insurance, Medicare, and the list goes on and on and on. So we're your go-to folks when it comes to Medicare error, abuse, and fraud. Melinda and the fabulous area agencies on aging across the state are your people to go to if you have questions on benefits. Next slide. And we have a wonderful mission. As you can see, there's a picture of Melinda Gardner teaching our mission before COVID happened. It is to empower and assist Medicare beneficiaries, their families, and caregivers to protect, detect, and report healthcare fraud, error, and abuse through outreach, counseling, and education. And those are the 3 words that will keep you out of trouble: protect, detect, and report. Next slide, please. This is a recent case just to show you an example. If you're from the Houston area and have Houston media, you've probably seen this story. Our team actually turned in one of these cases to what's called the Medicare control units. And this CEO was basically has charges against him. He's now waiting for trial, but it was $134 million. Another case that we just recently finished, and again, we turn in the documentation, we turn in like Medicare summary notices, was a home health care agency out of the Houston area for $9.8 million. Next slide, please. And now I turn it over to Melinda Gardner.
All right, thank you, Jennifer. And as Jennifer mentioned, scammers read the headlines. And so it's important that we know what's going on. So let's start off with the COVID vaccines. We're going to talk about the scam alerts with that. There are several agencies that are warning the public about several emerging fraud schemes related to COVID-19 vaccines. the Federal Bureau of Investigation, the Department of Health and Human Services, Office of Inspector General, and the Center for Medicare and Medicaid Services, as well as the Texas Senior Medicare Patrol. These are some of the scams related to COVID-19. Now, some of you may know about some of these scams already. You may know someone that has been involved in some of these scams. If so, go ahead and place that in the chat if you know of someone that has been involved in any scams, actually. All of these scams have taken place at one time or another. For those of you outside of Texas, you know, these also may apply and also may be more prevalent in certain areas. So let's take a look at a few of these. Supply misrepresentation, what does that mean? Well, you may get some people going door to door, providing flyers that look official. And so you think, oh, this may help me. For instance, the N95 mask. You think, I can get those N95 masks. They're not the same mask used in the hospitals or the ERs. They may be advertising them as the same mask, but they're not. So you have to figure out how to protect yourself. There may be fraudulent ads on vaccines that are available, or virus kits that you can send off for, but they're saying you have to pay for it. Genetic testing has been around for several years, where you can find out your DNA or find out about your history. Those are all scams. If you want to find out anything about vaccine, about the coronavirus, you must get information from reliable sources. And for any type of testing, always start with your doctor. Here's an example of supply misrepresentation from 3M for the type of mask that was distributed, and it is not an N95 mask. And so they did put out a bulletin letting people know that it was not legitimate. And then there are scam websites that claim to sell, you know, other face masks, online stores that may look legitimate. You always have to check the URL or the web address, because sometimes that web address may look legitimate, but maybe there is a misspelling, and you may not catch it right away if you're just glancing at that website. Scammers may even impersonate the World Health Organization or the CDC and others. Jennifer, do you want to talk about the senior care packages?
Absolutely. So let me tell you a little secret. We're going to talk about this a little more in a minute. Did you know that a Medicare number is worth at least $30,000? That's right, $30,000. And scammers know this. So scammers are going to do anything and everything they can to try to get your information. And guess what? The number one thing in the news right now is COVID. So scammers got sneaky. And what they did is they started calling people around the country, especially Texas, and they'll do something like this. Hi, is this Melinda Gardner?
Yes, it is.
Hi, Melinda Gardner. This is Jennifer with Medicare. I want to make sure you never get coronavirus. So I want to ship you hand sanitizers, hand wipes, N95 mask, Lysol, some gloves. I just need your Medicare number. What is your Medicare number, Miss Gardner?
Did you say you were with Medicare?
Yes, I am with Medicare, and I'd like to prevent you from getting COVID-19.
Isn't that a federal agency?
It is a federal agency, and we would like to provide you a senior care package today. What is your Medicare number, please?
Medicare will never call me. Where are you calling from?
Well, Miss Gardner, if you refuse to give me your Medicare number, I'm going to have to terminate your coverage with Medicare.
I'll call Medicare and find out.
Good job, Melinda. Medicare will never, ever, ever call you on the phone. You're going to get a call from the Queen of England before you get a call from Medicare, because it's not going to happen. And these scammers will be very nice, but then they'll turn very ugly. They'll even threaten to cut off your benefits. Again, they will use anything to get that number. And with COVID, They want to show that they care, right? And that they're going to ship you this information. Wrong. Medicare doesn't cover any of these supplies. So again, it's a sneaky way to try to get your information using COVID and fear tactics. Melinda?
All right, miracle cures. How many of you have heard that, okay, here's a witch's brew where you can have a miracle cure for coronavirus, or maybe an herbal tea or essential oils? There is no such thing as a miracle cure through a product. Some say they're harmless, some dangerous. You just don't know. So again, if you have any questions, always start with your doctor to find out, what's available. But there is no miracle cure. All right, one of the other ones that we wanted to go over is the Medicare scam. Medicare scams have been around forever, but of course, with the coronavirus, the vaccine, that's just another layer of scams that our scammers are trying to use. They are attempting to bill Medicare for sham tests or treatments related to the coronavirus and are targeting individuals to illegally obtain money or Medicare numbers. What are sham tests? Those are just tests that are not for real. So again, your doctor is the person to contact. The other day, I was watching TV. I saw this commercial about a test that I can get. I don't have to go anywhere. They'll ship it to me to test if I have coronavirus. That is a scam. That is a sham test. If you are watching TV, you see these commercials. If you have a question, make sure you're calling your doctor or make sure you're checking out a reliable source. There are some items that are legitimate, but you should start with your doctor to check that out.
And Melinda, can I add to that real quick?
Sure.
Whenever you do watch those commercials, if you have a pause button, because not everybody has a pause button with their TVs, but if you do, pause it where you see that tiny print and get out your magnifying glass. I have a magnifying glass for everything, and you'd be amazed at what you see when you actually put this up to the TV screen, because again, like Melinda said, it's definitely a scam. Sorry, go ahead.
Yes. Some providers are initiating calls to patients to do a check-in only with no exam. The provider then bills for an exam. With the expansion of the telehealth services, then providers are able to still get paid for those types of services. However, if they are initiating the call, it is not an exam. If you are trying to get into your doctor to have a visit, then you're initiating that call. So make sure you are checking your Medicare summary notices to make sure those billings are correct. Why is that? Because this is your money. You may not be paying anything out of pocket, but it is your money, and in the long run, it may cost you more through higher health care costs. Big question. COVID-19 Medicare coverage. Does Medicare cover COVID-19 testing and vaccine? Yes, Medicare will cover tests ordered by your doctor or healthcare provider on or after February 4th of last year. So since that time, Medicare is covering the test. And if it's medically necessary, they will cover hospitalizations, including any extra days in the hospital for patients who had to stay longer under the COVID-19 quarantine. So if someone calls saying, hey, we can get you this test, all you have to do is send us X amount of dollars, it is a scam. We just talked about the telehealth services, how Medicare expanded that to enable beneficiaries to access a wider range of services from their provider without having to travel to a facility. This is a big deal. I mean, before we always had to go to the doctor's office to be seen. Telehealth services is really an enhancement because we can still be able to get services through our provider. This includes doctors, nurse practitioners, clinical psychologists, and licensed clinical social workers. During this pandemic or the emergency, there are also more options for the ways your provider can talk with you under this provision. So if you're not sure, you can contact Medicare or feel free to contact us to find out more information. This COVID-19 vaccine checklist was something that was pulled from the smpresource.org website. It just lets you know if you're not sure if you're eligible for a vaccine, you can call the CDC. I have Medicare, so I don't have to pay for a vaccine. That is true. If somebody's asking you to pay for it, contact the Senior Medicare Patrol, and that's the national number on the screen. And if you have more questions, great place to contact is the CDC. One way to avoid COVID-19 vaccine scams, check a reliable source. There are some other COVID-19 related scams here, and we're going to go over a few of these in more detail on some later slides. So what are some of the red flags? We've already talked about unsolicited emails, telephone calls, or personal contact from someone claiming to be from a medical office, insurance company, or COVID-19 center requesting personal and or medical information. Unsolicited requesting personal and or medical information. That is a scam. Anytime somebody calls you and requests that information and you have not contacted them, then it is a scam. Claims of Federal Drug Administration approval for a vaccine that cannot be verified. Any advertisements for vaccines through social media platforms, email, telephone calls, online, or again, unsolicited or unknown sources. These are red flags letting you know, do not provide any information. Individuals contacting you in person, by phone, or email to tell you the government or government officials require you to receive a COVID-19 vaccine. Are you required to receive the vaccine? No, you are not. That is your choice. If you have a concern, speak with your medical provider. Did you have any more to say about the senior care packages?
Don't pick up the phone if you think it's Medicare, and remember, they can change the number in your caller ID. It's called spoofing, and a lot of people can do and will pretend like they're Medicare, the IRS, Medicaid. By changing that phone number in your caller ID, don't pick up the phone. Let it go to voicemail. It's another trick to try to get your personal numbers.
And if you have any questions about someone contacting you or sending you a package, contact the Senior Medicare Patrol so that it can be checked out.
And at the Senior Medicare Patrol, our smallest case was $18. Our biggest case with conviction was $9.8 million, because that one we just saw was not a conviction. Remember, that Medicare number is worth more than a credit card. Please protect it. That is your money. Last year, 90 billion with a B, was lost in Medicare fraud, error, and abuse. But that's what was caught, because not everybody knows to look at their Medicare summary notices. So start looking at those summary notices. If you see something that doesn't look right, call us. Call us. We're here to help you. We're not here to judge you. If you did give out your phone or your Medicare number to one of those scammers, we're not going to be rude or ugly to you. We're there to help you. So guard your card.
And that also applies to your Social Security number as well. Do not give that out. I have had several calls in the last couple of weeks where callers were asking for a Social Security number, and a parent did give out that information. So guard your card, whether that be a Medicare card, Social Security card, or a credit card.
And I want to add on to that. There's something that Robert Obregon, who's on our line today, that is one of our team members, always tells people, and this is so true. So a long time ago, like in the 60s, and you could use your social security number for everything. In fact, I remember 40 years ago in Beaumont, Texas, where I'm from, that our gas bill was in my mom's social security number. That was our account, was my mom's social security number. Back in those days, your social security number was used for everything. Your check account, your college ID, your military ID. It's no longer the case in this day and age. So when people get a telephone call, they might easily give out their social without meaning it. They don't realize what they just did could lead to identity theft, lead to somebody else trying to claim taxes or get a stimulus check or benefits under their name. So it's very, very important that we go out there and we talk to folks about, don't give out your numbers. It's very important because, again, we're talking about the greatest generation that was the normal. The norm was using that social security number all the time. So it's just something to be mindful of. And when you talk to people, don't talk at them, talk with them about it. So, and I believe I'm covering the surveys, correct?
Yes.
Yes, okay, thank you. So as you know, we've been talking about COVID, and we're about to change the topic in just a bit. But the biggest thing we're seeing right now is a lot of people are going to get their COVID vaccines. Well, guess what? Scammers are following the headlines, and they love to capitalize what is the biggest on the news, and it's the vaccines. So what did they do? They came up with a fake survey scam. They're sending you an email, a text message, a phone call, or even coming to your door just to ask you about, your experience. And then they ask you a lot of personal information. You need to hit the pause button. If you ever were to do a survey, you shouldn't give out your social. You shouldn't give out your Medicare. You shouldn't give your banking account information. You shouldn't give any information. And in fact, the scammers are really trying to get your information, or they might try to offer you a reward. We understand that you just got your COVID vaccine. We want to give you $50. What is your checking account number? Hit the pause button. They're not going to put $50 in your account. They're going to take money out of your account. Now, the other thing you need to be very careful of is if you get an email with a survey, don't click on the link. And the reason why is it can load malware, which is a virus to your computer, and it can put your personal information in jeopardy. In order to keep you safe, next slide, please. What we highly recommend is the Centers for Disease Control would like you to register for the Be Safe program. This is a program that has basically Medicare, all the vaccine companies, which is Pfizer, Moderna, Johnson & Johnson, would like you to go ahead and sign up on this website, because what this does is it will ask you if you've had any side effects of the vaccine. And if you have had side effects to the vaccine, someone from the CDC might actually contact you to ask you what were your side effects. But the biggest thing to know is they will not, again, ask you for any personal information, just about the side effects. Again, they're not going to ask for those personal numbers. Also, on this website, you cannot make appointments. It might give you an appointment reminder to go get your second shot, but this is the safest tool there is out there. And know that the other companies, there are no surveys at this time, but this is the only tool that we recommend that you use, and it was approved by the CDC, Centers for Disease Control.
Great. Thank you, Jennifer. Now we're going to look at tips to avoid the COVID-19 vaccine-related fraud. So we mentioned before, consulting using reliable sources in order to get information. So consulting your state's health department website for up-to-date information about any authorized vaccine distribution channels, and only obtain a vaccine through these type of channels. Check the FDA's website for current information. Consult your primary care physician. That is always appropriate because they know your background. They know what you should get. They are the medical professional. Someone calling you on the phone, you don't know for sure if they're a doctor or who they are. So always check with your primary care doctor. even before you're getting the vaccination, asking the doctor if they recommend it for you based on your medical history. Never share your personal or health information with anyone other than known and trusted medical professionals. That is always, always, always a good idea. As we mentioned before, check your medical bills, Medicare summary notices, and if you don't have Medicare, your insurance explanation of benefits for any suspicious claims, and report any errors to your health insurance provider. Once you report it to your health insurance provider, if they don't do anything about it, you can contact your insurance company. If you think it is fraud or if you think something is wrong, the Senior Medicare Patrol is available to assist you. Make sure and follow guidance and recommendations from the U.S. Centers for Disease Control and Prevention, the CDC, and other trusted medical professionals. So what happens if you do find something on your Medicare summary notice, or maybe you have received a service, or you didn't receive a service, but yet it shows up on that Medicare summary notice? Well, there are several agencies that you can contact to report any type of scam, or if you think something is wrong. The Texas Attorney General has a consumer protection division. The Federal Trade Commission is available to help. Of course, the Better Business Bureau has a consumer complaint line. And then if you want to report Medicare error, fraud, or abuse, then you can contact the Texas Senior Medicare Patrol if you're in Texas. If you're in another state, you can log on to, go to smpresource.org and find the Senior Medicare Patrol in your area. Some additional resources, this would be to find the most current and reliable information about COVID-19. Of course, the CDC, the Federal Communications Commission, the World Health Organization, Medicare has some information also, the Texas Department of Health, again, as well as the Senior Medicare Patrol, the Resource Center. You can find a lot of the information on the scams we're presenting on there. And again, you can find information on what you can do, also on how to volunteer. Now we're going to change gears, and I'm going to turn it over to Jennifer to talk about some other types of scams, since we've been talking about COVID so much, even though that is one of the top scams, but we do have other scams which may be in your area.
Thank you, Melinda. We're seeing so many scams right now, and one thing I believe they all have in common is we're all a lot of us are social isolated right now, and believe it or not, COVID. It seems like COVID will never go away, even though we're going to discuss scams that are not COVID. They're related to COVID in a way, and one that we're seeing a lot of right now, unfortunately, we call it stealing from the grieving. And what we're seeing with this one is someone just lost a loved one. It's either their spouse, child, niece, nephew, friends. It's happening a lot right now because of COVID, and we're not allowed to be with our loved one in some of the situations because they might be in a nursing home, or they might be in ICU with COVID or something. So we're seeing a lot of that right now. And what we're also seeing right now, I personally get the Houston Chronicle here at my house in Spring, Texas, and I noticed that the obituaries, there's more pages these days because of COVID. And not everybody puts obituaries in the newspaper. Some do it online directly. Well, I want to tell you something, my friends. Unfortunately, friends, families, and good people are not the only ones that read the obituaries. So do scammers. And scammers like to read the obituaries, find out what they can about the person that passed away. Sometimes what happens is a scam artist, a criminal, whatever you want to call them, I like to call them scum of the earth, scammers, they'll create a false bill or a false claim, and they'll call the widower, or the person that just lost a loved one, or even go to their door saying that you have a debt. The person that just passed away, Henry, we'll call him, owes $90,000. He didn't tell you, but he took a loan out on the house. And if you don't pay it, then you're going to be out on the street. We've even seen scammers come up with fake contracts, and don't let that sloppy signature fool you. They're trying to scam you out of money. They don't care that you're suffering from a loss. They just want your money. Next slide. We like to tell you about the scam, but we also want to tell you how to stop the scam, because again, according to AARP, the more you know about the scam, you're less likely to fall for it 80% of the time. So what we want you to do, and I know this might be hard for some of us, is if you just recently had a loss in your family or a friend, or you know someone, tell them. If you get a phone call from a bill collector, if you get a knock at the door from somebody saying that you're going to lose your home, I want you to hit the pause button for a minute, especially if they're trying to get you to make a fast decision, if they want you to pay it now. Because guess what? Take a moment, do your research, make sure it's a legitimate company. We have Better Business Bureaus all over the nation. Call your local Better Business Bureau. Find out if they are a legitimate business. Ask for a contract. Make sure it is a true, real contract. Ask a professional, ask a family member to read it with you. And don't let a signature fool you. Take your time. I know that personally, as soon as I get a bill, I want to pay it or make a payment arrangement because I like to keep a good credit score. In this situation, take a moment back, think about it, think if your family member took out anything or not. And sometimes they'll even tell you that they might have done something that is embarrassing to try to get you to open your pocketbooks. So just hit the pause button, do your research. And now we're going to the next one, which is unneeded repairs. We see this a lot in the Houston area, and it's basically where scammers will try to take advantage of your good nature. Some scammers, crooks, criminals, will case neighborhoods, and they like to case neighborhoods of seniors and people that they think can't fix their own repairs in their home. They'll go looking for like broken windows or like a little crack in the window. They'll look for missing shingles or maybe a busted tail light. And sometimes they wait for a natural disaster, like here in the Houston area after Hurricane Harvey, or right after this winter storm we had. That's a perfect disaster for them to try to make money. And what they do is they insist that you need the repair. You need the repair now. And it happens to be your lucky day because they have leftover repairs and they have leftover materials and they just helped your neighbor. They just helped your neighbor. And for $400, they can patch your roof and they could even fix your sprinkler because it looks like it has a broken sprinkler head for $400. So what they're going to do is they're going to get on your roof, make some noises, and then it gets dark. They started too late in the day. Then they're going to leave and you never see them again. And guess what? They have your money. They have your money. Other things are they might pretend like they are the utility company. They're going to pretend like they work for the water district. They're going to be an imposter. They're going to pretend to be something that they're not. And what they're going to do is say, if you don't pay $1,000 today, we're going to cut off your water. We have to have our water. And there are some people that really need to have their water. These people are trying to hold them for ransom by saying, we'll cut off your water if you don't give $1,000. We've had some victims say, well, I don't have $100, but I have $200. And they're like, okay, that'll work. So how do you prevent this from happening? Next slide, please. Do your research. Again, I want you to put the pause button. I want you to keep in mind, if anybody is pressuring you, you've got to do this today or I'm going to cut your water off, and call the local police department because nobody should be threatening you like that. Nobody should be trying to make you make a fast decision. You have the right to make a decision. You have to think and take your time. You should ask for references before you let any contractors or anybody come to your door. You need to be mindful of people that go door to door, because in this day and age where there is a store on every corner, the internet, the Better Business Bureau, people shouldn't be knocking on your door for your business. So you need to be very cautious who you let into your home. And remember, these people are going to work for you. Interview them, ask for references, ask for licenses, call them on their phone to make sure it's a working phone, because believe it or not, we've had some contractors give out fake phone numbers. Get a contract. No matter what you have done to your home, get a contract. And in the contract, try to make sure everything you can think of is in the contract. For example, if you're going to have a tree removed from your backyard, try to remember, well, I need the stump removed and all the limbs removed too. Because some people have had a tree cut down and they'll leave the stump and all the limbs. So sometimes think outside of the box. Try to think outside. Do your research. Ask friends and families. And if you are looking for a good, reputable company to do any of your home repairs, remember the Better Business Bureau. Go to a store that you know and trust. Ask them for recommendations. Ask for friends and family, their recommendations as well. So the next scam we're going to talk about, and I'm sorry to my team that's heard me say this before, this is the kind of phishing I don't like to do on my weekends. So this is a term called phishing. It has to do with our email, believe it or not. And what it is you might get an email that you believe is from a store, for example, your spouse, a coworker, your boss even, a friend, and it's not. Again, it's an imposter, it's a scammer. And what they're doing is they can actually make it look like it's from Amazon, but it's not the real Amazon. And what it is if you open that email and click on a link, it can load viruses to your computer. And the scary thing about viruses on your computer is it can do a lot of damage. For example, if you were looking at your bank account earlier today, did you know if you get a certain virus on your computer, it can do something called log your keystrokes? That means it can figure out your passwords, it can figure out your usernames. So be cautious, be very cautious. And something else that scammers love to do is they love to threaten people. For example, they like to threaten people saying, I know what you've been looking at. Like they'll send you an email saying, I know what you've been looking at. If you don't send me $500 today, I'm going to send the pictures you've been looking at online to everybody in your email list. And they might name a few people you know in the email list. Don't let them scare you. It is a fear tactic. It is a fear tactic. Simply delete. Next slide, please. So I want to keep you safe because this is one of the biggest scams that we see. First off, I want you to take your mouse, your cursor, which is your mouse. If you get an email from what you believe is your friend or family member, for example, I'm sending Melinda an email, it should say Jennifer Salazar, right? So she's going to put her mouse over Jennifer Salazar's name. If it says 123monkeys.gmail.com, Melinda's going to know, is that Jennifer Salazar? No, that must be a scammer because it would say something like J Salazar at BBB, okay? So that's one way. Another thing is, don't respond. Don't send back an ugly email saying, well, how dare you reach me? Don't do that. Don't do that because they're phishing. Again, that's why they call it phishing. They send the same email out to thousands. They're trying to get you to open your email so they can download if you click on a link, they can download a virus, or they're trying to see if you're a real person. So the best thing you can do is you can get mad, you can scream at the world, you can do whatever you want, just hit delete. Just hit delete because guess what? They didn't scam you. Next slide, please. Now we are looking. By the way, Melinda, I believe it looks like we have a scammer on the line.
Yes, and it looks like it's under Marty Mascari's name.
Now, ladies and gentlemen, tell your lady friends or whoever, if somebody gets a picture like this asking to be your friend on Facebook or Twitter, say no. This is an example of looking for love in all the wrong places.
You think you're getting this, but you're but this is what you're getting.
So before this is what you think you're getting when you get your friend request, ooh la la. But in reality, you get he's not coming back. Okay.
No, he's not going to come back after that comment.
No, but we love Marty and Marty.
Yes.
And
I was like, what did you need?
You still get ooh la la. You get Marty. But, and this is one reason, my friends, that we need to watch what our children are doing as well. Because our children might think that they're chatting to a perfectly, to something not. They might think they're talking to another child, but it might not be another child. This is what we need to watch out for, as well as the romance scam, looking for love in all the wrong places. We've had callers as young as 18, to as young as 85 years old. And this is something we need to watch out for. The romance scam can happen in so many different ways. One way it happens is online. You go looking for love online, or it finds you online. For example, before COVID, our boss at the BBB Education Foundation received a call from someone that thought she found love again. It was her 50th high school reunion, and she was on Facebook. And somebody asked to be her friend. Well, it was her high school sweetheart. So she thought, oh, we're going to get to talk to each other before the reunion. Well, they build up a rapport, they build up a relationship. But guess what? Melinda, he couldn't afford to go to the reunion because he just lost his job. So the caller was so sweet. She sent him some money, sent him new clothes, money for new clothes, a plane ticket, a car rental, some money for food, just very sweet. So they go to the reunion. She sees him. He's handsome. It was wonderful. But there was a lady on his arm. What's going on with that? It was his wife. Say, what? Guess what? It was a scammer pretending to be him on Facebook. It wasn't even him. It wasn't even him. Other ways this happened is, for example, you might have just lost a loved one and you get a phone call out of the blue. Guess what? Remember how we said that scammers read obituaries? Scammers read obituaries as well for the romance scam. They wait a few weeks, months, then they contact the widow, widower, build a rapport, build a relationship, and then it might not be romantic, and then they're going to hit them for money. No matter the case, we've seen this in so many different situations, but I want to talk to you real quick about a case that we just worked on. A lovely lady, not going to say from where, 87 years young, fell in love and nobody knew it, because one thing that scammers want to do is they want to isolate you. You've all probably seen this on Dr. Phil or, all the shows, but it's this big. Did you know that FTC, Federal Trade Commission, saw a 50% increase in the romance scam in 2020? And we believe it's because we're all isolated. But what happened was this lady, 87 years young, fell in love. She's been in a relationship with a gentleman for 3 years and no one knew it until her computer broke. When her computer broke, she asked her daughter, could she borrow her tablet, her daughter's tablet? The daughter said, yes, Mom, of course you can borrow my tablet. Well, the lady got her, we'll call the lady Rosie. Rosie got her computer fixed and she gave the tablet back to her daughter. Well, her daughter went on the tablet and she couldn't help it. We're nosy. She looked at her mom's history because she was nosy. Well, she noticed that her mom was looking at this profile with this very nice, attractive young man. She found out that the gentleman was 40 years old. He lives in Afghanistan. He's ex-military. And she was reading the messages and it looks like it was a, romance. And then she noticed that her mom was depositing a lot of money in her bank account. And something is off here. So she asked her mom about it. Well, her mom told her all about it. She met a gentleman a few years ago. They fell in love. He wants to move back to the United States. He's stationed in Afghanistan. He's no longer in the military. He lost his wife and he has a daughter. And he needed her to help him move back home. And he's going to live with her and she's going to help raise the daughter. The story goes on and on and on. And yes, it changes frequently because it's a scammer. So what the mom did is she did take his money because she wants to help him get set up in America. She's going to help pay for his apartment. She's going to help pay for his bills. So he would give her money and tell her to keep some of it if she could just transfer it to pay his taxes, to set up this, to set up that. Without her realizing, she becomes what they call a money mule. That's somebody that will take money that is illegally acquired and they keep moving it. And the reason they keep moving it, she didn't know she was part of the scam. She didn't realize that she was money laundering. And the reason he told her to keep some of it is because now he pulled her into the scam. And the reason he wants to keep moving the money is it puts layers between him and investigators and the police. So what you need to do is next slide, please. Be very cautious of anyone you meet online. Be very cautious of anything you put online. For example, everybody and anybody, and don't let the private settings of social media fool you. If you have social media and you're like, well, everything's on private, guess what? It's really not, because hackers can find out anything. Be careful what you put on the internet. Be careful if you go out of town. Don't post pictures of your trip until you're back. Be careful, because scammers look at the online. They look at when you're on vacation. They look at when you have the loss of a loved one. If you believe that you did develop a real relationship, get a picture of that person, put it on 10i. And what you could do is a reverse search. As you can see, this gentleman, Marty, not the real Marty, if you take that picture and you do a reverse search on that on 10i, guess what? That picture is probably going to show up a million times, because that picture is probably on a million different websites. Whatever you do, never send money, gift cards, wiring. If someone wants to be your friend, they won't ask for these things. And the biggest thing about the romance scam, be very cautious, because they do tug on your heartstrings. They do act like it is love. I know in my experience, I've never been able to convince anybody that it's not really love. You're brainwashed because you really believe this is the real thing. So hit the pause button. If you're dealing with a loved one that believes they're in a relationship, be cautious, be patient. You might want to talk to their doctor to make sure that they're capable of making their decisions. Now, remember, people have the right to make bad decisions. You can make bad decisions, but just make sure they're not suffering from early signs of dementia, because we want to make sure that no one's scammed. Next slide, please. Oh, and real quick, let me go back to that real quick, Melinda. Something that we're seeing a lot of right now is gift card scams. If anybody calls you trying to get a gift card, for example, the romance scam, if they're tell you just send me a gift card, or if a store is pushing you for a gift card instead of cash or a payment, be cautious, because that is also a sign of scammers, because gift card scams are really hot right now. Okay, the next one is the grandchild hook. Now, this has been around for years and years and years, and it used to be called the grandparent emergency, or the emergency scam, okay? Because guess what? What is the biggest thing in a grandparent's life? I'll let Melinda answer that.
Their grandchildren.
Now, Melinda's grandbaby can't call her yet. He FaceTimes, but he is 2 years old, or he will be 2. But guess what? That is like my children, my 11-year-old and 13-year-old. That is my heartstrings right there when they're good. But anyways, this has been around for years. In the past, it used to be something like this. Grandma, it's Jenny, and it's spring break, and I've been arrested, and I'm in Mexico, and yes, they did find drugs in my car, but it was Haley's, it wasn't mine, and they're going to put me in jail, and I need $1,000. That used to be the scam, right? Back in the day, a big emergency, grandmother's here to save the day. We now have a twist on it. They do that sometimes, but what they're doing now is, grandmother, it's Jennifer, and I'm so embarrassed to tell you, I lost my job. They closed down the factory. It's COVID, and I don't know how I'm going to make ends meet. Jimmy's teeth are still crooked, and we got to get the braces fixed, and I can't afford it, and I can't afford my light bill, and we're eating Roman noodle soup every day, and I just don't know what I'm going to do. Can you just lend me a few bucks? And then I call her back a few days later. Thank you so much. I mean, I finally got the power back on, and I have a job interview, but I need help. Can you buy me some clothes and a haircut, please? But guess what? There's more to this scam now. Next slide. Scammers have a technology. And remember, scammers also watch the internet. For example, on my Facebook page, I have pictures of my fabulous grandmother, who is 83 years young, but I don't say what I call her on there. I'm not even going to tell you what I call her on there. Did you know, and when I do videos, when I talk with Melinda, when I'm doing speeches, I watch what I say as well. Let me tell you why. If you have access to the internet, if you have a telephone, did you know that you could be recorded? Your voice could be recorded. For example, we had a volunteer of ours that has a granddaughter, and we're going to change the names up a little bit, okay? Her granddaughter used to like to do YouTube videos when she was younger, and she used to like to braid hair and stuff. Well, in one of the videos, she was doing her Nana's, we'll call her Nana, she was doing her Nana's hair, and she would say, if you want your hair to look like Nana's, you've got to do it this way because her hair is very fine. Okay, a few years later, Nana, our volunteer, which we'll call her Rosie, Rosie gets a call at 2 a.m. And it goes like this: Nana, it's Veronica. Hi, this is Sergeant Parker, and we have Veronica. She's been arrested for a DWI, and if you don't come right now, she's going into jail. You can either come to the station, we are in Georgia, or you can send $5,000 in gift cards right now. Well, guess what? Technically, it is Veronica. It's her voice. Scammers will get a sample of your voice online, on the phone. They'll use just enough, and then a very mean person will come on the line, or somebody of authority, per se, will come on the line. It's a scammer. They're trying to get your information again. They're pulling at your heartstrings, and guess what? It's your grandchild. How do we stop this? First off, whatever you do, don't send money or gift cards. Especially don't send gift cards because it's harder to trace, right? Have a code word. Why do I say have a code word? Well, it could be like a password. My kids have a code word. I have a code word. For example, make it a word that only you and your family know. Only tell trusted family members. That way, if you get a call from someone pretending to be your grandchild, if you say, what is my code word? If they don't know it, you know for sure that's not your grandchild. Now, a few years ago, my grandmother's code word was Johnny Depp. She has a crush on Mr. Depp. But guess what? That's not her code word today. Try to make it a code word that you can remember. And ask personal questions. Say, well, how's the baby? Oh, the baby's doing great. Well, your grandchild doesn't have a baby. Now, next slide, please. Durable medical equipment. So this is a big scam that has been around for years. It's not going anywhere. Do you remember how we were telling you all that Medicare will never, ever, ever call you on the phone? That is very true. But scammers really want that Medicare number. They're going to do anything they can to get it. So they'll even do something like this. Hi, Miss Gardner. This is Jennifer Salazar from the Pain Management Center. How are you today?
Good. How are you?
I'm great. Are you in any pain, Miss Gardner?
Yes, I am. My back has been hurting.
Oh my goodness. Oh, so if your back is hurting, that could also be a neck problem. Are you having problems sleeping at night with your neck and your alignment?
You know, I am.
Oh my goodness. And by the way, do you ever feel tingling in your feet or your hands or?
You know, I am, yes.
You might even qualify for our arthritis kit. So, Miss Gardner, let us get you over to Dr. Salazar, who's going to do an assessment. Hello, Miss Gardner. Do you have, so your age, okay, what is your weight, okay, what is your, okay. I'm going to ask Miss Gardner a lot of questions, and then I'm going to get her back to Jennifer. And Jennifer's going to be so sweet, Miss Gardner, thank you for completing your exam. All we need is your Medicare number because Medicare will go ahead and take care of this. The doctor's appointment, you don't need to go to your doctor because Dr. Salazar just examined you, and Medicare's going to pay for your equipment. Next slide, please. Wrong. Did you know that anybody that says the equipment is free or Medicare is going to cover it is a liar? They're a scammer. And what they're probably going to do is they're going to send you junk. For example, Exhibit A here is a carpal tunnel glove, or so they say, and this is going to cure you of arthritis and carpal tunnel. Now, this went on Medicare for about $250. And as you can see, I can do all kinds of damage to it. But guess what? This is probably worth $10. Exhibit B. This was sent to a gentleman that is 6'2", and that weighs 392 pounds. He's 392 pounds light, and this was supposed to fit his knee. Guess what? That's not going to fit his knee because it's an adult small. Why would they send this to him? Because it's cheaper than the 1X. And last but not least, the knee brace that went for about $2,000 on Medicare, but we found the exact same knee brace at a DME, durable medical equipment shop, for only a shocking $20. So if you get a phone call offering you any equipment, watch out. And this is what you really need to watch out for, is if they're telling you, we need your Medicare number and if they're trying to get your Medicare number, they're going to bill Medicare. And guess what? The biggest thing is you may never, ever, ever get equipment if you really need it. For example, if you are having knee problems, Medicare may not pay for this someday. If a scammer charges Medicare for one of these, if you need it in the future, you can be denied from it. Also, unfortunately, we've seen beneficiaries, people on Medicare, that will actually take this equipment and sell it and make a profit. That is Medicare fraud. Also, they might give out their Medicare numbers, making money off of giving out their numbers. That is also Medicare fraud. Next slide, please. I want you to watch out for the following. I want you to watch out for suppliers that want you to use their doctors. They don't even want you to contact your doctor. That's a red flag. Only your doctor should prescribe any of this equipment. The company bills for duplicate orders. For example, you ordered one of these, you ordered the left hand, but the company sends you the left and the right hand, and you didn't order it. Watch for duplications. Also, this is one we've seen before, suppliers that bill for people that passed away. For example, there was a gentleman that passed away. He was one of our clients. And after he passed away, after the date he passed on, these companies kept trying to bill medical supplies to him. Guess what? He passed away. There's no way he could use those supplies. That's something else that you have to watch out for. Also, this is the biggest one. Suppliers that offer you off-the-shelf generic stuff. This wasn't made for real medical use. This is something that you can get at any local grocery store, the pharmacy. I mean, you can go find these at your local Walmart. Next slide, please. All right, now I know some of you have been waiting on this one, and we saved one of the best for last. And we will answer your questions in just a little bit because we're almost to the end where we can take more questions. All right, did you know, Melinda, did you know that in 2019 and 2020, Texas was #1 for receiving the most robocalls in the nation? With about 157 per Texas resident. That's right.
Oh my goodness.
And when you get a robocall, a lot of times it'll ask you to press 1, or you say, or you say hello. Well, what that robocall and the scammer behind it's trying to do is find out if you're a live human being or not. That's all they're trying to accomplish. So whatever you do, don't press anything. Just simply hang up. Because if you press something, that only confirms, again, that you're live. And then what they're going to do is they're going to take your phone number, they're going to research your phone number, and they might commit more scams against you. For example, once I play with phone numbers, Melinda picks up saying hello or presses 1 to get off the list. Then what might happen is I call Melinda back a few days later. Melinda Gardner, this is Connie with the IRS. You owe $5,000 in back taxes.
No.
Wrong. Again, don't answer the phone from numbers you don't recognize. Next slide, please. If you don't answer it, don't pick it up. And I know that's so hard because you own this. This is your piece of property. Set up the first line of defense. Check with your mobile or your landline providers to see if there's apps or equipment that can stop this. Did you know a lot of apps are free? And a great tip that I want to give you all is if Medicare ever calls you, the IRS calls you, we know it's not them. Get a whistle, blow it in their ear because scammers don't need their hearing, or get a cowbell. These are about $2 at a craft store, or get an air horn. Don't fall for these scams. They are scammers. They are criminals. Hang up. It's okay to be rude. I know that a lot of us grew up in a time where we were polite. We would say Salazar residents. Unfortunately, those days are gone. If you would like to get up-to-date information from us, you can join us at Scam of the Week, or sorry, Scam of the Month. We have a wonderful email blast once a month with the most current scams. Our latest and greatest was Protecting Your Goal. It was talking about ways to protect your money and ways to keep your money safe from scammers. I think now would be a great time to open it up for chat if we want to go through the chat box and some Q&A. And maybe, Marty, if we want to have some people, if they want to unmute their lines, but however you want to do it.
Yeah, we'll do it with the chat. It really gets cumbersome to try to unmute. But a lot of people have talked about experiences that they've had or know somebody here.
One of the questions, what about the new online medical providers that are self-pay?
Those are different because it's not billing your Medicare, and that's up to you if you want to go with one of those. Me personally, I have sometimes at night just a little bit of tingling, and when I wake up, sometimes my fingers are a little numb. So I got something, you know, online that I paid for. I didn't do with my insurance or anything, and it seems to work, and my doctor was fine with it because I did check with my doctor. Again, always ask your doctor to make sure you're not wasting your money. But you know, that's okay because that's not Medicare fraud. But if they're asking for your Medicare number, your Medicaid information, your insurance, just be leery, because on anything that's going to be charged by your insurance, Medicare or Medicaid, you want to go through your doctor.
I think she's asking for you to back up one. There you go. There you go. I hope, Carla, that's what you're looking for.
Yeah, for Jennifer's email address to get the scam of the month. Okay, great. Wonderful. Yes, that was what she was looking for. All right. Any other questions? I don't see anything else in the chat. I know there was one person that mentioned, had a volunteer that received a letter with a survey for PASS, the Social Security Lockbox Act petition. It asked for $14 in the first envelope with more envelopes to follow. Scam, scam, scam. Anything about Social Security can get reported to the Social Security Administration or the Texas Attorney General's office. In order for those agencies to do anything, they have to know about it. And so that's why our job is important to make sure we get that reported. Sometimes we don't hear back of what happens with the cases, but it's still important to report it because in the end, it's costing us money as taxpayers.
And for all you know, you might be the first one to report it. You might be the very first one to bring attention to this. And a lot of times these agencies need just one. And don't be afraid to report stuff. When you call the Texas Senior Medicare Patrol, know that your information is confidential, and it is a federal grant. It is a federal grant. So there will be no charge to you because you're a taxpayer. You already paid for this service. So use this service.
Right. And with the current pandemic, as Jennifer mentioned earlier, it is so important to keep in touch with your family members and your friends, the older adults, because some of them are used to, you know, socializing, going to the senior center, going to church. And if they're not able to do that anymore, they're isolated, which is more opportunity for someone to scam them. So it is important to make sure they are aware and that you are communicating with them. On this slide is Jennifer Salazar's contact information. The Texas SMP hotline, that is a separate number, and then also her direct number, as well as her email address. And again, you will be getting this presentation. Some of the scams that we shared on the one slide has links to another presentation. But if you feel that you have been scammed or that you think there's something wrong or you know someone, have them contact the Senior Medicare Patrol so that we can follow up. Here is my information as well.
Oh, there's a question from Robert. Do the do not call registries not work anymore?
So Melinda, can I take that one?
Okay, sure.
Okay. Yes and no. So they do work for companies, yes, but but the biggest thing that we need to all keep in mind the people calling you is not always a company. They're scammers. And that list doesn't apply to scammers. Scammers will call you. They'll pretend to be from government, from companies, your neighbor. A lot of times they like to use your area code. I'm originally from Beaumont. I have the same phone number I did back in college 20-something years ago. My phone number starts with 409. Do you know how many calls I get a day from 409? It is a scammer that can change the caller ID, the number in the caller ID, to 409, whatever number they want. They're trying to get me to pick it up. So if I'm on the do not call registry, yeah, companies won't be calling me, but scammers will still call you. And even if you block the numbers, they're still going to call you. They're going to find ways in. So that's why it's so important that once you need to set up the first line of defense by contacting your mobile provider or your landline. A lot of times there are free ways to get apps, and on your landline you can buy devices to stop these calls. Also, we had a lady that just said that she got a call from her own number. Yes, again, they do that because you're curious. You might pick it up, or you might think, oh, that must be voicemail. No, they're trying to get you to pick up the phone. They're trying to see if that phone line works or not so they can scam you later.
You'll also get emails that will come from your own email address, quote,
Right.
and tell you that, you know, they've taken control of your computer and it's going to cost you X number of dollars for them to not, you know, not lock you out.
Pam says, we contacted the U.S. Senator's office in Signer, mentioned in the letter. Their offices reported the letter to be a scam. We researched it and found that this scam has been resurfacing since early 2000s. We did report the letter. Wonderful. Yes,
Good job,
wonderful.
Pam.
And yes, it is important to check with the official agency, not necessarily on the information that you're receiving, such as an email, or when you get a telephone call, they may give you a phone number. It may not be legitimate. So if you're calling the number they're giving you, it's going to route you to whoever their partners are. And so you may not know that, but it's always important to call the official agency to verify.
And look up the actual agency's name, because, for example, you won a sweepstakes, congratulations, you get a letter. And remember, scammers don't just impersonate people, they can do and will steal logos. And for example, you might get a letter from what you believe is the Publishers Clearinghouse. It might even have the Publishers Clearinghouse logo, their address, all their information. You call the number to get your prize, and they have to collect taxes. No, you don't pay to play unless you're going to Louisiana. But here's to play at the or at the casino. This is what you need to know. Go online, type in Publishers Clearinghouse. Make sure that is the real Publishers Clearinghouse. Call us at the BBB. We'll look it up for you. Call them directly, because scammers can do and will steal logos. Call the official source. Don't believe just the letter. Don't believe just the letter. And just because it has the logo doesn't mean anything. Unfortunately, anyone can make anything look official these days.
Yes. That's all I see in the chat.
Great. Outstanding, y'all. Very, very good. Thank you all so much. Jennifer, Melinda, thank you for doing a great job. It was a very, very, very good information. I will be sending a follow-up email out to everyone. It will include, again, the link to the slides. It will include the link to my survey that we're talking about here. And just so you know, this is not a scam. It's not me asking you to send gift cards to me. It's me going to be sending gift cards to you. And so to the top 3, not to everybody, to the top 3 people we draw names out of. But and again, you can enter anytime, I mean, any number of times you'd like. But just know that this is running. We ran it all month. It's running till midnight tomorrow. So if you have ideas, please get them in as quick as you can. Once again, the link for this survey will go out in a follow-up email in just a few minutes, along with the link to the slides for today. And then in a few days, I'll send a second follow-up email that will have the recording of today's webinar.
And here's a perfect example that we know it's not a scam. Marty's not being pushy. He's not asking for your banking account. He's not asking for your Medicare number to enter this contest. And he has been vetted. So this is legitimate. And if you have great ideas, turn them in. Who knows?
And he's not asking for money.
And I'm
He's not
telling you,
asking-
right in front of the Senior Medicaid Patrol and the Business Bureau.
And we have our executive director on the line too, so we know.
There you go. But if you get a call from somebody that looks like this,
I
don't
know.
answer the phone.
You know, it's interesting. For a long time, I did not receive calls in reference to romance scams. And in the last 2 weeks, I've heard of 5 people that have participated in the romance scam, or their family member has participated. And so they're trying to figure out ways to explain to them, hey, it's a scam.
Yeah.
So just beware and share this information with others.
They know there's so many people that are lonely and isolated because of COVID, and they're going to take advantage of them. It's just terrible.
Right.
But yeah.
And there was even a church in the Houston area that had to have, they called it an intervention. And they actually asked us to be on the phone during this intervention to try to convince this lady that it wasn't really a true relationship. Somebody has their hand up, Marty.
Yeah. If you could put, if you have your hand up, if you could put what you have your hand up for in the chat. Barbara, if you could either put that in the chat.
I can unmute. I think you can unmute one at a time.
Yeah, but we're gonna get into a real
Oh, okay.
If we start, we told people we weren't gonna do that. If we start doing that now, we're gonna do. Pierre just put something on here that he's getting calls all day. It will have my same area code and prefix, and they just changed the last 2 digits. I don't know from which organization because immediately blocked. Well, a lot of those numbers, if you try to call them back, you'll find out the numbers aren't any good. I mean,
right.
You wait for them for it to be a missed call. You turn around and try to call it back, and the number's not any good. So
right, and then the next time they call, it's still a different number. They're calling from a different number, but it's the same scammer.
Yeah, that's right. Barbara, did you have something that you had your hand up for? If you'd like to put that in the chat. Okay, well,
oh, that's
text?
a good one. What about text and emails from political contributions? First off, we don't get political, but that was the #1 scam last year. Here's the biggest thing. If you get a text out of the blue asking for money for Daffy Duck running for senator's campaign, and you didn't contact Daffy Duck for senator, don't give. If you really want to give to a political candidate, find their headquarters, contact their headquarters directly. Don't wait for something out of the blue unless you signed up for it, unless you went to their website asking for text, emails. That's okay, but if they contact you out of the blue, be very cautious because it might not be the candidate. Also, be cautious of GoFundMe accounts. You want to always make sure that that person is really the person that they're asking donations to, because unfortunately sometimes those are also fake stories.
Yeah. The other thing I'll tell you, go ahead, Melinda.
I'm sorry, there's a question in the Q&A. There are phone apps that block robocalls. Are they any good?
Well, so I don't endorse, recommend, I have to say those things, Verizon, but I was getting a ton of robocalls a day, and I downloaded a free app that I found out through Verizon, and it really worked for me personally. What I recommend is contacting your provider and see what they have, and you want to ask for the free one, because a lot of times the free ones work just as good as the ones that cost money. But here's the biggest thing. I always say nothing in life's free but your mama's love, and there's always some kind of, scam involved. You're already paying for these services with your mobile provider, so ask. And I don't get political, so if anybody else wants to take that one in the chat.
I get robocalls from Donald Trump. Is this
from
a scam?
Okay, or from, yeah. I always name a
And
cartoon character. It's a scam.
And Robert, it could be. That's all I
We
can
don't
say.
know.
Yes, someone asked about the text messages from Amazon or from UPS about delivering packages, and I get a lot of those that are scams.
Exactly.
Yeah.
Especially around the holidays. And again, a lot of us want a package or something. Be careful. Just be careful. If you do order something, get the tracking number when you order it. Don't just wait for things to pop up on your phone.
Mm-hmm.
Well, very good. Well,
About settings that allow you to block. Emily had a comment. iPhones have a setting that allow you to block unknown numbers and they won't ring or interrupt you. Just a helpful tip.
very good.
Very good. Thank
That's
you,
good.
Emily.
All right. Well, thanks again, Marty.
Thank you all so very much. Thank you to our speakers. Thank you all for joining us. We sure appreciate it. Look out for the follow-up email that will go out in the next hour, and then the email with the link to the recording in a few days. Thank you so much and have a great day.
All right.
Thank you, Marty, for
you.
letting us play.
Take care.